one of the most important things is making sure that your doctor knows what your goals are and what your wishes are. They may not understand what any individual person's life is like and the problems that they may have with their epilepsy outside of the seizures themselves. So it's important to voice those goals so that we're all on the same page. Another important feature is making sure that you have fairly precise information for us. So how many seizure types do you have? How often are your seizures? What sorts of medications are you on? What doses do you take? And importantly, do you have side effects related to those medications? Because having that information clearly stated can help us make decisions quickly if we need to, say in the event that something happens and you have to call in or write a message through patient portals. Another important factor for communicating with your epilepsy team is asking questions that you have. A lot of people have questions, and many times they may feel intimidated or shy or even embarrassed to ask, and so they may go unanswered. But you should never feel embarrassed or shy or worried about the questions you have. They'll be answered if you ask them, but they won't be if you don't, right? Never be afraid to ask. It's also important to share the concerns that you have, which is another thing that goes missed often, right? People will ask questions about what may happen or about their medications, but maybe they're a bit embarrassed about voicing some concerns that they have, for instance, about cost of medications or costs of testing or difficulty with travel, as people with epilepsy will often have to rely on other people for rides or public transportation, and that can impact care. So getting that out and open is important for us as well. One of the most important things to consider and to remember, both on our end as a provider and on a patient's end, is that we shouldn't offer surgery and won't offer surgery unless we feel like it's ultimately in the person's best interests. Other questions to ask would be, what type of evaluation are we really going to be doing? So what is involved in terms of measuring seizures and monitoring seizures? What's involved in terms of more imaging tests that may need to be performed? What's the process by which we reach our decision as far as whether or not to offer surgery? On top of that, you may also ask what type of procedure would be done. Are we talking about removing a portion of the brain? Are we talking about using a laser therapy to address the area where seizures are coming from? Are we talking about using stimulation to help stop seizures? So there are lots of different things that we may do as part of procedures that go into that. And then lastly, of course, what are potential risks of surgery? So if I have surgery, what might my memory be like? What might my speech be like? And then what is the overall likelihood that I'll be seizure-free after surgery? All of that is decided upon based off of a lot of information that we gather. So up front, those questions are not always able to be answered. But as time goes on, as we learn more information, a clear picture should develop.